Tonight we have Dr. Alex Samuel, who is Chesterfield County's Health Director, and we also have Chief Lois Center from Fire and EMS, who are going to share a bit of information about where we are with the COVID-19 and our response. And then we will open it up to your questions on Facebook Live. First, let me introduce Dr. Alex Samuel, who is the Director of the Chesterfield County Health Department.
Thank you, Susan. So much has changed over the past few weeks that I don't think anyone's life has gone unaffected. It's hard to believe that a little less than 3 months ago, the world began hearing about some cases of an unexplained respiratory illness in China. Since then, the attention of the world has been focused on this quickly spreading virus, which doesn't respect international boundaries. Closer to home, we've been trying to adjust to some pretty incredible measures that are aimed at protecting the most vulnerable members of our society. We're not going to school, we're working from home if we're able, and we're not able to spend much in-person time with friends and many of our loved ones. Most aspects of normal life have been changed. And all of this to fight an invisible enemy that we don't know a whole lot about. Understandably, many of us are anxious and confused. So, right now we're at 11 cases of COVID-19 in the county, with the first case diagnosed on March 11th, which was 2 weeks ago. Information is one of our best resources and best defenses, and the Chesterfield County government has worked hard to keep residents of the county informed. I truly appreciate the ways they partnered with me to get the information out. So I look forward to this opportunity this evening to share what I know with you. I'm going to turn it over to Chief Center.
Good evening, everyone. As you may know, the county's Emergency Operations Center was fully activated on March 16th and consists of a team of 200 county employees representing 25 county departments and our constitutional officers who are working continuously to coordinate the county's emergency response and recovery efforts from the direct effects of this crisis. Because the need to maintain appropriate distance and not risk virus spread among county leaders and county staff, the EOC is being conducted virtually. The charge to our EOC team is that this crisis will be unlike anything in our lifetime, requiring innovative thinking and flexible execution of activities focused on protecting life and minimizing effects on the community. As you know, the county government has moved to a newly developed operating status called Open with reduced operations, and schools have closed for the remainder of the school year. While it has been necessary to close some county facilities, such as recreation centers, senior centers, libraries, and certain amenities at our parks, my message to our business community and to our citizens is that Chesterfield County government remains open for business. Our public safety and other essential services are always provided regardless of circumstances, and through the ingenuity of our county employees, many more county services are being delivered, albeit in different ways. A multitude of human services are still being provided to those in need. Permits and inspections are still being performed each day. Connectivity is being maintained with our seniors and those in the community who are disadvantaged. And the school system has provided food to thousands of students in need. We continue to redeploy county employees where needed to provide support to those departments who are on the front lines in dealing with the immediate effects of the crisis and to prepare for a likely increase in human services needs in the weeks to come. Moreover, we have established a call center during the week to answer questions citizens may have about county government operations and services and to capture any unmet needs that may arise. And so to that end, we'll be happy to answer any questions that you may have.
Thank you, Chief Center. Appreciate that. We are getting a variety of questions in, and we're going to just go ahead and dive into them. I have several questions for Dr. Samuel, but I'm actually going to start with Chief Center first, based on his information he just provided us. We're operating with reduced operations, and we've seen what the governor has imposed. Do you foresee any additional things, to occur in terms of a lockdown, or is it just too early to tell at this point as things are evolving?
Well, I think it's too early to tell, and perhaps Dr. Samuel will be in better position to answer, some of the protective measures that have been put in place and whether more broader protective measures would be put in place in this community. One of the things that we need to keep in mind is that some of the lockdown orders or stay-at-home orders that you're seeing are in the more densely populated areas, such as New York City, Los Angeles, the West Coast. We don't have the density here that a lot of urban centers have. So while we may see some areas that could be isolated because there may be a cluster of cases, or if you have a facility like a nursing home that has a number of cases, we have to take some action items there. But again, those areas that you're seeing, those broader rules, tend to be in the more densely populated areas.
Thank you, Chief Center. And now I have a variety of questions for Dr. Samuel. So, Dr. Samuel, we are getting a lot of questions about really the community spread, if there is community spread. And what does community spread mean when people say that?
Right.
There's a lot of fear that we already have it and that it's going to get worse, but we're really not there, right?
Right. So the term community transmission simply means that when we do our investigation, we spend a lot of time to aggressively follow up individuals who are true positives, meaning individuals who have tested positive for COVID-19. And we speak to them, we try and figure out who they have been in contact recently, individuals with whom they are in contact with great frequency, and try and, if we can, find some sort of ultimate source or common source. When we talk about community transmission, that simply means that we cannot find that common or ultimate source. And so that simply indicates that it's being spread somehow in the community, that there are individuals who do have it, who are simply not being picked up by testing. And so one thing that happens when you test more is that you certainly find more cases. And right now, we are kind of at that point where we're still learning and feeling and trying to understand the extent of it. It's very hard to make a clear quantitative comment on degree of spread. I think in the ensuing weeks, we will have a better picture as this unfolds.
Thank you. We're also getting a lot of questions about testing.
Yes.
So the number of cases that Chesterfield has reported, does that include the individuals that were tested last week? And what does that include, and do we expect it to increase?
Sure. So I think you're referring to the point of testing site, correct, Susan? Right. Yeah. So last Friday, the Chesterfield Health District, in coordination with County Public Safety as well as County Fire EMS, conducted a very large drive-through testing opportunity for individuals who fit certain criteria. And these are individuals who were symptomatic and wanted to rule out the presence of COVID-19. A total of about 140 individuals were tested at that opportunity. We are still waiting for test results. The tests were run through a private lab, LabCorp, which is inundated with tests right now. So we're still waiting, maybe a few days out from getting those test results. And to speak more broadly to the issue, Susan, yes, I think the availability of testing is something that is lagging, both in terms of test kit availability, which is probably the primary issue with regard to being able to test quickly, as well as being able to actually do the testing itself. So on that end, that's improving a bit.
Okay, we have some more questions about some of the cases that have been tested positive.
Sure.
In terms of location. There are rules and regulations in terms of what you're allowed to disclose. Is that correct? Because we just hear about cases per locality, and why is that exactly?
Right. Yeah. So one of the principal aims of medicine, public health in general, is to protect the identity of individuals when they access healthcare. In public health, we protect the individuals who are positive, regardless of the type of issue that we're talking about, from mumps to COVID-19. And so the regulations at the state level indicate that We typically cannot disclose locations of cases at a level that is less than the district level. So, for Chesterfield Health District, which we cover, it's Powhatan County, Chesterfield County, and the city of Colonial Heights. That rule has been relaxed a little bit under the circumstances of COVID-19, simply so that localities have some sense, generally speaking, of the levels of illness in their community, so that we can work together to address it.
Okay, thank you. We're also getting some questions about whether animals can get this. Do you know, can this be passed to your pet, or can you get it from your pet?
Right, that's actually an excellent question, and one that I think there's still a lot of science that has to be done. I think part of the issue with referencing that in the media, you'll actually see references to that issue on really reliable sources like the CDC and the World Health Organization, is because this virus originated from an animal source. It's called a zoonotic virus. And so it managed to jump species. It moved from what is believed to be a bat through an intermediary animal to humans. And so therefore there is that potential for it to go back. However, we simply do not know whether it truly can. There have really been no cases so far of that having been seen. Advice, however, to individuals who are positive for COVID-19 is to refrain from taking care of your pet if you can, again, to reduce the possibility of that happening. If you're not in a circumstance where somebody else can take care of your pet, the guidance is to wash your hands frequently before and after taking care of your pet.
Thank you, Dr. Samuel. Again, we're getting some more questions about tests. Is it something where every resident in Chesterfield County has to be tested for COVID-19, or is it where we just test the individuals with symptoms?
Correct,
And
yes.
would that change?
So the current practice is to test individuals with symptoms, which makes sense, partly because tests are a scarce resource. Generally speaking, you don't test individuals without symptoms for any sort of condition. One of the guiding principles of public health is you test people with symptoms in an effort to control this disease of any sort, particularly those that have a lot of potential for spreading quickly. And one of the ways that we do that, which we're doing now, is when we get a positive case, we ask that individual to self-isolate to get out of circulation from the general public. So in that respect, yes, we test those who are symptomatic, and that testing then helps control the spread of disease.
You know how we got the question about community spread? What about outbreak? Is there a different definition for outbreak and community spread, or is it the same thing? Because we're hearing all of those words. And can you explain those a little bit more?
Yeah, so that's a very good question. There typically is a more specific definition of outbreak that's used in epidemiological investigation, and that usually is describing the spread of disease in a confined space. So when we think of an outbreak, it's usually an outbreak in an institution, a hospital, nursing home, a school. I know the term is used very commonly in the public sphere with regard to spread of disease in a population as well. When I talked about the epidemiological use of the term, there is a specific number of people who get a disease in a point in time and space, usually about 3 people. That constitutes an outbreak. I think it's probably fair to apply the term more generally speaking to what's going on now and use the term simply to indicate a wide spread of a infectious disease. When we talk about community transmission, however, that is more a term that really gives us, again, that sense of it spreading without knowing where the source is. And one of the things that we do when we have community transmission is advise to use various forms of social distancing approaches, many of which are being used right now.
Okay, thank you, Dr. Samuel. I think that's pretty much wrapped up all of our questions that we have. You can certainly send in more questions if you have them, and we will get those answered and post them on our webpage, and also post that on our Facebook. So that's going to wrap up our briefing. Thank you very much for joining us.